by making everything really complicated, by focusing on your hormones, by telling you, you're broken and need to be fixed, I don't view that as empowering. I don't think that's a positive direction that we're going in.
You're listening to the Active Mom Podcast with host Dr. Carrie Pagliano. I'm a mom, physical therapist, and your go-to guide for staying active with pelvic health issues in pregnancy, postpartum, perimenopause, and beyond. Whether you're a fellow mom, physical therapist, or women's health professional, join me where I'll share expert insights, real-life stories, and the latest research to help you approach running, CrossFit, yoga, Pilates, HIIT, or whatever activity you love with confidence and evidence-informed guidance. Let's start the show. All right, welcome back to the Active Mom Podcast. Our next guest, I have been binge following on Instagram recently, and she's been making the rounds on a lot of major podcasts. I'm a huge fan because she does a lot of myth busting, which I love. So our next guest, Dr. Lauren Colenso-Semple, she is not only a myth buster PhD, but she's giving us a lot of information to help sort of debunk some of the things that we're hearing out in the women's health space. And so we brought her on to bring those myths and tell us what really is going on. So Dr. Lauren, welcome to the show.
Thank you so much.
All right, tell us a little bit quickly about your background and kind of what has drawn you over into the myth busting side of communicating healthcare information.
I'm a former fitness professional turned scientist. And so while I have a deep understanding and interest in physiology, exercise science, muscle, hormones, I've always tried to keep a hand in the kind of practical space, because I think sometimes scientists get really lost in a science only bubble, and then we're just communicating with each other, and it's sort of like, what are we doing all of this work for if not to communicate it to the people who actually need it, whether it's people who are trying to improve their own health and fitness, or the coaches and other practitioners who are guiding their clients and patients. So when I ended up doing a lot of research in what has become a sort of controversial hot topic on the internet, and that wasn't really by design. It just was happenstance. I looked at the influence of menstrual cycle phase on how we adapt to exercise, and kind of addressed some of this messaging around cycle syncing, which became this huge trend in the past 5 years or so. And in sharing some of that work, I realized how much other misinformation was out there, really targeting women specifically. So that's really what drew me to the space, or more so, I would say I felt like I had a responsibility to add a voice of reason to try to combat some of this, because I realized how much confusion there was online.
Yeah. And I've been a clinician 25, 26 years, and I can read the research, but I can't get in the weeds. And that's where I'm so appreciative of your voice, because I think a lot of us were going into it wanting to be as educated as possible. And sometimes we're running into voices that, just because they sound overly complex and nuanced, that they must be right. And my spidey sense has always been, maybe that's not the case. And so we're going to do a little bit different thing here today on the show. We're going to go into a quick lightning round on some of the hot topics. And as a perimenopausal woman myself, so many of these, I have friends that are dying to hear your answers. And I've already sent the link to your Instagram account. So why don't we start with the one that you just said, with cycle syncing workouts, because that's the one that you know the most about. Give us the quick hit on the first, the social media says, and then where actually the science is.
So the message on social media is that we should be changing our exercise program based on cycle phase. And so one of the common programs you might see is, 1 week of lifting, and 1 week of high intensity interval training, and 1 week of yoga, and 1 week of just walks and light stretching, or something like that. And this is something that I addressed from a scientific perspective, of really looking at is there something to these hormone fluctuations? Will they affect how we perform, how we adapt? The answer is no. And from a practical perspective, adjusting your workouts all the time is really going to hinder your progress. We need to be consistent, and we need to progress in what we are doing to work towards the goal. So if you want to improve running performance, you need to run regularly. If you want to get stronger and more muscular, you need to lift weights, and it needs to be challenging, and you need to do it consistently. So any kind of program that has you constantly mixing things up is really going to end up with you spinning your wheels.
Yeah, as a mom, that's kind of a non-starter because I don't even know what day it is today. So I'm like, I'm not going to be able to get that right. But I think there's kind of a version of that that has started to come up in the perimenopause space, saying, okay, we forget what you did before. Now you need to do this amount of HIIT training, this amount of sprint training. Zone two is bad. Only jump on da da da. Like, what are you seeing in social media? And then what is there to specific? Do I have to change all my exercise, now because I'm perimenopausal?
Yeah, I think there is sort of a through line here where we're making everything about hormones and hormone profile and fluctuating hormones or declining hormones. Um, and with the perimenopausal space, it's even more confusing because, frankly, I see messages that low intensity cardio is terrible for you. Never go for a walk again. High intensity cardio is terrible for you because it's going to spike your cortisol. So don't do that. Um, it's really, really confusing. And then, oh, but by the way, you must do sprint interval training, because you're a perimenopausal woman, and that's going to be better for your muscle and bones. And so it's just a mess, especially with
Mhm.
the cardio space. And I think the major thing I see is this: you must or never, that kind of
Mm,
language that I really, really don't like, because all exercise is good, all
right,
physical activity is good. And what I said before about consistency, if you're somebody who loves doing HIIT training and that's what's going to get you to the gym, then great. If
right,
you're someone who hates that, you will not do it long
right.
term.
Yeah. No, I feel like we're back in, like, I'm having PTSD from the 80s and the 90s where they're like, you need to eat this food and do that thing and then you'll get smaller. And I'm like, are we really traumatizing a whole other generation again of Gen X and like older millennials are like, this is wrong. Why are we doing this again? But where does that come from? So that's the thing that I think it drives me nuts is like, they'll quote studies.
Mhm.
Are these studies that are in perimenopausal women, are these studies that are in humans?
Yeah, they're pretty much, you can find a link to a study that will support anything that you want to say. Um, and that's unfortunate because that really muddies the water for science communication. But what we know is, if we want to be truly evidence based, we need to look at the literature as a whole, because
Hmm.
one single study never tells us all the answers. And that's why, in medicine, for example, you would never approve a drug based on a single study.
Right.
And the same goes for exercise and nutrition guidelines. We need a lot of data before we say, oh, this should really inform what we're telling the public. So the problem with picking one study that shows, oh, high intensity interval training increased body fat loss in perimenopausal women, let's just say, but the group they were comparing it to did nothing, then it
Right.
shows that high intensity interval was training was effective for fat loss, but not compared to lower intensity.
Right.
So, and I see a lot of that with the weighted vest trend, that people will
Yes.
cite this study where people were wearing weighted vests and the other group did nothing. And whenever you compare something to nothing, that something is
Right.
going to look good.
Yeah, no, I think that's something that, again, if you're not in this space, we know to look at the methodology or see, are you even looking at the group that I'm interested in? But I think the average person, and it's shifting, but it used to be, well, research says, and I'm at the point now in my clinical career where I'm like, I'm looking for research to maybe kind of explain some of the things that I'm seeing clinically, but I'm not looking for any like brand new magical thing that all of a sudden it's going to change my life. But again, to your point, something is better than nothing. Why are we, and I'm going to save this question for kind of the chat later, is like, why are we focusing on these minutia? And I mean, again, these are all things that I think we're looking for, that like that quick hit or that fix. Weight loss in perimenopause. Like that was one of the questions I got from an audience member, is like, ask her where we start. I'm like, oh my God, I don't even know. Like, because we're literally seeing memes about you should eat number of grams of protein as stars in the sky, which it feels like that. But where are we supposed to be on protein? What does social media say versus science?
So the recommendations are, as you say, they can get really sky high. And I think we as a scientific community pretty much agree that the RDA of the zero point 0.8 grams per kilogram of body weight is too low. And we do see an improvement in a bump up to 1.2 grams per kilogram. But the recommendations that are going upwards of 1 gram per pound or 2.2 grams per kilogram are unnecessarily high. It's not bad if you like eating protein. It won't be harmful if you find that protein is satiating. And so, if you're trying to lose some body fat and eating a higher protein diet makes you feel full and makes that journey a little bit easier, then great, that's a tool to use. But what I see is a lot of people saying, I couldn't possibly consume, this much protein. And then we don't even get that bump up to the 1.2.
Right. Yeah, no, it's the same thing with exercise. It's like, okay, can we just do the baseline first, be consistent and really good about it before we start worrying about this other stuff? What about intermittent fasting?
It's interesting because about a decade ago, maybe 15 years ago, fasting was all the rage. People thought it was going to be this game changer for health and for fat loss, because when you look at what you're using for fuel during exercise or maybe an hour post exercise, there were these acute trials that said, oh, there's more fat oxidation here. I wonder if that means if you always train fasted, will you lose body fat, more efficiently? And it turns out no, because we sort of adapt our fuel utilization for the rest of the day. And so it doesn't affect long-term fat loss. Interestingly, now we're getting this opposite message that training fasted is terrible and it's going to increase body fat accumulation or decrease muscle mass. And that's equally untrue. So the way that I view fasting is that it's a tool if
Hmm.
that helps you create the deficit that is required for fat loss. For some people, just shortening that feeding window can be helpful. It's not magic. It's just a
Hmm.
tool to create the deficit. But if you're somebody who prefers to train fasted, maybe you get some GI disturbances if you eat right beforehand, maybe you work out really early in the morning, that's completely fine. As long as you're
Hmm.
getting in enough calories and protein throughout the day, then we don't need to be worrying about these nuances of nutrient timing.
Yeah, yeah. How about creatine? I know there was just a paper just came out with Dr. Abby Smith Ryan on that. Tell us what's up with creatine and different points in kind of our, I guess, perinatal cycles.
So, of all the supplements in the fitness world, pretty much two of them actually do something. One is caffeine and one is creatine. And creatine can improve exercise performance to a small degree. We're not talking a game changing. You might not be something you would even feel, but if you're somebody who's already performing high intensity exercise or lifting weights and you're looking for a potential small improvement, then creatine can be helpful. It's widely studied, it's fairly inexpensive, it's safe. But if you're not doing those things and you're taking creatine and you're expecting to, build muscle from that, that's misguided. It's not
Mm,
worth taking. And if you're expecting it to help with your bone density, the research on that does not look particularly promising. I wouldn't focus on creatine for that. Uh, in terms of brain health and cognitive function, at high doses, we see there's some promise there in combination with other therapies when it comes to depression or traumatic brain injury, these kind of clinical concerns. We're not talking about um, boosting cognitive function when it's already at kind of a normal and healthy
Mm,
baseline. And those high doses of creatine can be really difficult for people to tolerate. When you start getting into that 20, 25, 30 gram dose range,
hmm.
people can have some really major GI issues that are sometimes difficult to overcome. So we shouldn't be looking at it as this kind of brain boosting supplement for the average
Right.
person. We shouldn't be using it for increased bone density. You might consider using it for that small boost in exercise performance.
So a lot of these things really aren't first line at all, but that's so much of where the conversation is. So yeah, I've heard you talk about kind of your interest in talking more about kind of how to communicate good healthcare information, good research information. Why do you think these things are coming up now? Whether it's, specifically these things that we kind of ran through the lightning round with versus other topics, and what should we actually be kind of paying attention to and doing?
I think whenever you overcomplicate something, it's a very easy entrance to a sales pitch. Because if I tell you that, this is so complicated because of your hormones, because of your age, because of your background, and, you need to be really concerned about your muscles and your bones and your body composition. And then I say, and I can help you buy my
Mm,
program, I can help you buy my diet, I can help you buy my supplements. Then I think that is really, unfortunately, the motivation behind a lot of this, because making it really complicated and overemphasizing these supplements that are probably going to do nothing or maybe something minimal, and typically when we want to take a supplement, it's usually to address a deficiency. If you don't have the
right.
deficiency, then what are we supplementing? And so an overemphasis on supplements is a red flag, in my opinion, and a lack of acknowledgement for the basic things that don't cost anything, don't require you to hire a coach, don't require you to follow some complicated plan. That those are what will really move the needle. A nutritious diet, getting adequate protein and fiber, um, getting adequate micronutrients, being physically active generally, and then doing some consistent, progressive exercise, lifting
Mhm.
weights is really beneficial. I highly encourage people to do that. But there are so many ways that you can do that and benefit. You can use machines, you can use free weights, you can do circuits, you can do it at home, you can do it at a gym, you can do higher reps, you can do lower reps. As long as you're doing it,
Yeah.
it is beneficial.
Yeah. No, and even the what we call the basics, I feel like that still comes from such a point of privilege to be able to have some place that you can exercise safely, to have access to fresh fruits and vegetables and those sorts of things. Like every time I kind of hear these basic recommendations, I'm like, yeah, we're still really lucky to have that, but everybody's so focused on this other stuff. It's almost like the basics aren't sexy. I'm like, no, 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 that's privilege. Like we're lucky to have that. Why don't we start there? Why why do you think this has become so prevalent, especially with women that, are they're resonating with this messaging that we should be treated differently than men, that we should have things that are suited more to us? Why do you think that is kind of influencing some of these conversations?
It's interesting. I mean, I think that when you say this is for women, um, then women kind of feel seen and heard, and you want your experience to be validated. But I think it's actually backfiring, because by making everything really complicated, by focusing on your hormones, by telling you, you're broken and need to be fixed, I don't view that as empowering. I don't think
Mm,
that's a positive direction that we're going in. And the reality is, when we look at the science, the more studies that were originally conducted in men that are getting replicated in women, when it comes to exercise and nutrition recommendations, the same rules apply to
mm.
younger women, younger men, older men. And so we don't need to sort of flip the script and get these specialized programs, just because, you are in the menopause transition, or just because you are a woman.
Yeah, that one, I definitely see that, and it's so interesting, kind of having been in the exercise space and women's health for such a long time, that I feel like we were fighting for so long, one, to get women in the weight room, to get women running marathons, to getting them through pregnancy and postpartum, to getting acknowledgement that we can do these things, to getting research to support it. To your point, like, we fought so hard here. Are we almost fighting to make something happen that really isn't the case there, because we want to be heard so much? But in this scenario, like, exercise is exercise, food is food. Um, why aren't we okay with that?
It's funny, you'd think that the message that I put out is good news, right? We don't need to
Yeah,
overcomplicate it. The same things are going to work, and people get really angry about that. They
yeah,
think they say, oh, like the patriarchy and masculine training programs, and how
yeah.
dare you, you're ignoring women. It's like, no, there's nothing that is, truly feminist about saying, hey, I'm going to target you as a woman and tell you that you need to do all of these different things, because I'm really just trying to sell you something. And
Yeah.
everyone who is this, hormone balancing coach on the
Oh,
internet is really doing that. And it is so unfortunate, because you have people who are worrying about things that are not a problem. You have people thinking they have health issues that are not true.
mhm,
And then it actually ignores the reality of, oh no, we our hormones are fluctuating. We don't really have control over that. In a lot of cases, it's not an issue. You don't
right.
feel anything. But in the case of the menopause transition, that's the cause of symptoms if you have
Yeah,
these erratic hormone fluctuations. And there are ways to manage that and treat that that do not involve taking a bunch of supplements and hiring a
right.
hormone balancing coach.
Right. Yeah. Basically, anytime I have people that, like, I see hormone balancing, I'm like, and we're done here. Nope, we're not. Or somebody wants to be on the podcast, and that's their first thing, is they want to balance hormones and detoxify. I'm like, nope, we're out on
Yeah.
that too. But it's funny, kind of having navigated the Perry waters the last probably 2 years or so. I think, again, it's very easy to get caught up in the excitement, because we have big voices that are doing, and this is where I'm torn, because I'm very happy that people are bringing light to women and light to changes and things like that. But I felt incredibly overwhelmed, and it was hard when, patients asked me, well, what type of exercise should I be doing? When should I eat? When should I, how much protein, this and that? And I'm like, I can't even freaking figure this out for myself.
Yeah.
This is my day job, and I don't have, like, if you're asking me to literally do all the things and buy all the supplements and do all this stuff, I'm like, first of all, I'm going to be constipated as all hell. Second of all, like, fiber, I'm just going to say that one. But, like, I don't have time to do this and plan this. And it was just incredibly overwhelming. And then you feel like shit again, which, like, I'm not a fan of how we did that back in the 80s and 90s, and you're just constantly trying to be something that you're not. So when I listened to you on Natalia Mello's podcast, I was like, wait a second, saw this, like, and finally it's like, okay, somebody can go in the weeds and dive through this, because I didn't feel like I could. But to come back and give the freedom of actually, no, if you would like to lose weight, exercise, know your calories, calorie deficit. It's not something different. Just keep going back to your basics. And at first I was like, what? That could work? And I'm like, okay, it doesn't have to be so freaking complicated. And I felt so relieved because it was so freaking stressful. I was like, I
Yeah.
can't do all this. Like, and I can't be the only one that's thinking that, especially, these women now that are coming fresh off of postpartum and, having kids later in life and then having to dive headfirst into this shithole. Like, it's just, what the hell? Why is this happening now, by the way? Like,
I wish I had the answer. I mean, I think I agree with you. It's good that we're talking about it because I think people need to feel support, like they're not alone. I think it's good that men are hearing some of these conversations as
mhm,
well, because if you are a man, somebody in your life is going to go through
right,
menopause at some point.
right.
Um, but it's interesting how we've gone from this place of, oh, we would never openly discuss menstrual cycle or menopause, and it was kind of hush hush. I think that wasn't great. I think it's good
Mhm,
that now it's out in the open, and whether you're a man or a woman, it feels like, well, we can have open conversations about this. But as you said earlier, we used to kind of push back on this idea that we are being reduced to hormones. And someone would say, oh, you're angry, you're irritated, you must be on your period. We
right.
found that pretty offensive. um, and or, oh, you're pregnant, you shouldn't move for the for the duration
Yeah.
of your pregnancy. um, and so we've kind of pushed back to say, hold on, we're strong and capable and way more than our hormones.
Yeah.
And how are we now at a point years and years and years later where it's come back around and the women are the ones doing it?
Mhm. Yeah, that is an excellent, excellent point. Yeah, no, that's a great question. And again, as somebody navigating this space personally, professionally, and then also raising two kids that pay attention to everything, they're both teenagers. Um, I am incredibly aware of kind of the example that I set. I mean, my mom was, she wasn't on like diets per se, but there was always a focus on eating her, you've got to do this to be smaller and whatnot. And my kids know I go to the gym, they know I go for a run. Like those things are very normalized. But if you've got your podium here, if you're talking to the average perimenopausal mom, couple of kids, they don't like the fluff around the middle that comes with perimenopause because it comes and we don't like it. Let's say they're already going to a class a couple times a week or they go for a run or something like that. Where where would you ask them to start? And where are the possibilities if they want to if they don't like how they're looking or feeling or things like that? Where do we give them to start? Because none of us know what the frick to do.
I think we tend to overestimate the impact of exercise on weight loss. It's there, but it's really small. And so, if fat loss is the goal, we really need to look at the diet. We should be exercising anyway, but getting really bogged down on, the number of calories your watch tells you that you burned from exercise, or the machine tells you burned from exercise. It's a lie. Don't pay attention to it. Um, and we, again, when you're really trying to create a meaningful calorie deficit that's going to result in fat loss, we need to look at the diet and we need to make sure the change that we're making is consistent. So I understand if you're somebody who doesn't want to track every single thing you eat. We don't have to start there. In some cases, if you're kind of fairly consistent with what you eat on a day-to-day basis, you might consider, are there places where I can swap something out? So there are, if you're drinking beverages that have a lot of calories, swapping that out for something else is like an example of an easy swap. Um, and if you're somebody who is so frustrated and you say, I swear I haven't changed anything
Mhm.
and I still can't make a dent, in my fat loss journey, then I would encourage that you actually do that kind of audit and track
Yeah.
everything and see it, because honestly, there are times when we just inadvertently make changes, and that could be due to recent retirement, or it could be because your kids are now out of the house and your schedule changed. Maybe you used to do a lot of walking just as a function of doing your daily activities, and you're no longer doing that anymore. Maybe your sleep is really disrupted, and so you're not motivated to get that workout in the same way you used to. Maybe your dietary habits have changed because you used to cook for a family and now you're no longer doing that. Maybe if you're a mom of young kids, you're thinking about what you're eating, but you're actually eating some food off your kids' plates
Mhm.
or eating some of their snacks, and you're not kind of clocking it. So we do need to be aware of all of those things when we say, oh, what I'm doing isn't working. But I think
Yeah.
when it comes to fat loss, we really, the diet is going to make a huge difference. And whatever change you make, we need to be patient because fat loss takes
Mhm.
time. It doesn't happen in a couple of weeks.
Yeah. No, I love that you say that because again, it always feels easier to grab the next, hot thing as opposed to look in the mirror and say, what am I actually doing? And we do that a lot in pelvic floor PT when I have people do like bladder diaries and things like that. I'm like, I need to know what's going in so I can look at what's coming out. Same thing with stool. And you can't change what you don't notice. And I
Yeah.
think occasional calibration, especially these times of year, we're coming into end of the school year. Summer schedule is completely different for, a lot of families, more travel, summer activities, all that kind of stuff. Like you're gonna have these natural transitions throughout your year. Unless you're really good, like you're not going to be eating the same thing. You're not going to be doing the same activity. You're not going to have the same stress. So is it really possible to be like, no, I didn't change anything?
Yeah. And you know what? There are phases of life where it's okay to just be okay with that. And it's not
Yeah,
the time to prioritize
right,
your I can say, when I was doing my PhD, I had so little control over my schedule and my
right.
day. The gym just was not a priority, and that had to be okay for
Hmm.
the time being. And so I think being kind to ourselves and giving ourselves a little bit of grace in those tough phases of life
Hmm.
for whatever reason, that's okay. We do the best we can. And then when we move to the next phase where we do have the ability to make it more of a priority, then we just make sure we do that.
Yeah, no, that's one. So on the podcast, we ask a lot of moms, kind of what's your best advice for moms, and that's always the one that comes up is, be patient, give yourself grace. And I think there's certain seasons we're really used to being like, yes, when you have a baby, do that. But I don't know that some of these other seasons we're used to getting that message of like perimenopause, give yourself grace. Like, that doesn't have quite the ring. You're
Y-
not taking care of small humans, but no, again, you're going to have times where you can, focus on those things, or it's a lot easier to do that, and other times that it's not, and that's okay. We don't need to be doing all the things all the time because that's a burnout recipe there too. So for you, kind of looking forward, you've obviously, you're putting out a lot of messaging on social media. You're talking a lot of podcasts. Do you feel like literally the myth busting will write itself from here on out, or I kind of feel like it's an endless job?
Yeah, it's funny, I didn't when I started, I never thought that there would be so much content to pull
No,
from.
it writes itself.
Um,
It's like jokes.
yeah, and there's always something new that I see that is out there that's and sometimes my reaction is no one would ever believe this nonsense, right? And people do. And so I think it's important to just keep kind of pushing back on that and be aware that if it sounds too good to be true, it is.
Mm-hmm.
If there was some, magic solution, we would all know about it. It would be very, very clear. The when GLP-1s came out for weight loss and those were approved, everybody knew, because that is a game changer in the obesity space.
Right.
um, it wasn't this kind of niche secret on the internet that you came across in a random post. So
Right.
if there's a game changer, you'll know about it. And until then, we need to just really be mindful of the kind of content that we consume. And I think as a part of feeling like you are in control of your own mental health when you're scrolling through the internet, if you are constantly consuming messaging from someone that is putting out this kind of fear-based content telling you
Mm-hmm.
that something's wrong with you and that you need to be fixed, or telling you that everything you thought you knew about this is wrong and
Right.
I'm going to just flip the script and tell you everything new, that's not messaging that is productive to consume, and that's not evidence based, because somebody who's truly a scientist or a healthcare provider who has the best interest of those of their followers in mind is not going to speak to you that way. It's not kind, it's not productive, it's not nuanced.
Mm-hmm.
And so unfollow those people. um,
Yeah.
and because you have to kind of protect your space. And I think it can be really the amount of time that we're all spending on social media these days, that makes a difference, and it can affect
Yeah.
how we talk to ourselves, and it can affect how we think about the success or failure, quote unquote, of
Mm-hmm.
what we're doing.
Yeah, no, and I think, the timeliness of this, I fear public health is dead for a lot of different reasons. And this idea that we have to do our own research and figure out what that looks like for us. Um, I read actual research. You are an actual researcher. I think that means something very different than somebody who does a little bit of scrolling and comes up with an answer. Um, is there a way to kind of check yourself and be like, okay, almost like a little self audit and be like, okay, who am I following? If you're willing, again, if you're willing to look in the mirror, which is a tough thing to do, how do you audit your own consumption and who you're listening to? Because I think if you're ready for that, if people are listening to if you're still listening and you're ready for this,
Yeah.
what can we do?
I think it's always good to follow a variety of people. So don't try to say what one person says shouldn't be gospel. And then remember that when it comes to exercise and nutrition, there is the science, but there's also the individualization. What are your goals? What's your availability? What are your preferences when it comes to exercise and diet? And that is always, although we have, the science, when it comes to actual exercise prescription or your own personal nutrition plan, that is going to be individualized to
Right.
you, because we can give you the most, optimal plan ever, but if it doesn't suit you,
Mm-hmm.
then it's not sustainable and then it's not effective. So what's the
Yeah.
point? And I think any messaging that is that rigid, that shows you, there's only one way,
Right.
it's just not true. It's clearly not true.
Right.
And so I think when we look at who we're following, make sure that there are different voices, and that the message that's communicated has some nuance. And so it might be as simple as, what, we don't really fully understand that yet. We need to wait for some
Yes.
research. When it comes to hormone therapy for menopause, that is a space where we need to be saying that over and over and over again, because the research is ongoing and research takes time.
Mm-hmm.
Science is slow, unfortunately. But we want, like I said in the beginning, we want enough data to say we actually recommend this. This does make sense under these
Mm-hmm.
circumstances for this group of people.
Yeah, no, and that's that. We talk about that so much in PT, obviously, that the best answer is an individualized one. But even if you're not in a situation that you can access a provider and, social media is your source of information, avoid those always and nevers. Always look and see if they're trying to sell something. I say that also as something that I have provided online programs to people. But you have to be, transparent with this is the information I'm putting out. This may or may not work for you. Like these promises, it reminds me of, like, again, the 80s, that all this for 1995, it's
Yeah.
like, no, we're not doing this again. Um, but again, I think I had somebody message me this morning. Unfortunately, it was a former patient. And so I knew her situation. She's like, who should I be following in this space? And I'm like, first of all, I need to understand where your question is coming from, because there is no catch-all person. And are you in an awareness stage of your understanding? Are you in I have a particular question and a particular nuance that I want to know more about this? Like, there's so many different people. Like, if you've just landed on planet Earth and know nothing about women in perimenopause, there's some people that I think on the surface are fantastic, and you get down in the weeds and maybe not so much. And then when you get down to more kind of exercise or diet or things like that, it might be something completely different. So again, we all have our own journeys individually, and understanding that, yes, we have some generalized things that we understand, but ideally, there's so many. We're complex humans. There's patterns, but we're complex. Um, so yeah, that's great information. Any areas or any myths that we didn't hit that are some of your most asked about myths?
The weighted vests for the bone density is a big one
Mm-hmm.
right now, especially in the perimenopause space.
Mm-hmm.
Um, so we maybe should touch on that. As I mentioned, there's a study that's often cited where people were wearing a weighted vest versus not doing anything at all, and there were some improvements.
Mm-hmm.
But weighted vest walking is not enough of a stimulus for muscle or for bone. And so, what we want is either for muscle, we want progressive resistance training. So, we want you to be lifting weights. It needs to be challenging. It should feel hard. But at the end of your set, you should not be able to do more than one or two more. That's sufficiently challenging, and
Yep.
that's what works for muscle. It's also beneficial for bone. If we're looking for aerobic exercise, we know that weight bearing, like jogging, is going to be helpful for bone and then also for cardiovascular health. But unless you just love walking with your weighted vest and that's
Right.
what gets you to go for a walk,
Right.
great. But let's not oversell the benefits of this, because it's really, we don't have good evidence to say, oh, if you did this versus doing a real structured exercise program, would it be a
Right.
difference?
Yeah, no, and correct me if I'm wrong, most of the studies that I saw were not, they were all menopausal, right? I don't know that there's any in peri to speak of.
I believe there, yeah,
Okay.
it would be in post. And the
Yeah.
other thing that we need to be honest about is that bone mass and osteoporosis risk has a huge genetic component. And even if you're
Mm,
somebody who's been super active your whole life, you might still have some challenges there. And luckily, there are some medications that can be really effective, if you are somebody who's in that category and has access to that. But the good news about just trying to maintain your bone density over time is that just being active, whether, like I said, you're lifting weights or you're
right.
doing some weight bearing aerobic exercise, both seem to work. Maybe a
Mm-hmm.
combination is best, but we don't need this like bone specific training. If
Mm-hmm.
there's a lot of messaging around needing to do jumping. It's not
Yeah.
that jumping isn't helpful. It can be, but it's not required. And so for people who don't like plyometrics or jumping type exercise, you don't have to do that. It really seems like the whether it's resistance exercise or like I said, weight bearing aerobic, they're both going to be helpful. And so we kind of go back to where we started, where do what you enjoy and do it
Right.
consistently, and it looks like that will be beneficial for both either muscle and bone, or your cardiovascular health and bone.
Yeah, with bone health, I feel like, or I'm sorry, not bone health, with jumping, one of the areas I do feel like might be interesting to look at is fall risk and things like that, because I would have to believe, I'm sure Christina Prevett knows the answer to this, but if you're training somebody how to fall, or, they're not just tripping over their feet or things like that, if they can clear the floor, all that kind of stuff, ideally, one would think that would decrease fall risk. So I'd be more on board with something like that. Um,
Yeah, I mean, I think you bring up a good point, right? Because we think about bone density as sort of a proxy for fracture risk, but
mhm.
if you don't fall, then you don't fracture, and then if you
Right,
do, and so part of that, I think, being that's another benefit to being a more muscular person, being a stronger person, being able
right,
to move through range of motion, because that will improve your just stability and balance in general, even
right.
without doing specific balance training.
Mhm.
So I think and just being able to be physically active in general, you're going to be
Right.
a more, functional human.
Mhm.
And so you're less likely to have that bad fall because active people can catch themselves.
Right. And honestly, I mean, like I've started doing more kind of jump training for my postpartum moms, one, because they don't ever do it. But most of us early postpartum, they feel like they're kind of running through molasses. And so I'm like, hey, we need to get up off the ground a little bit. But again, if you're more active, your balance is better. And then you've gotten on top of your pelvic floor and urinary incontinence early. Then when you get older, you're not waking up at night to go pee, so you're not going to the bathroom, so you're not going to fall in the middle of the night, and you're not going to break a hip. So it really does all come back to
Yeah.
the pelvic floor and postpartum. Guys, I can't help you, but but no, and I think the point there is it's good to do all these things. Start with the basics. If you're already active, yeah, add some jump training in, but don't necessarily it's good in general, but it's not going to buy you all the magic and the unicorns and the glitter that necessarily people are promising from kind of bone health perspective. And that's okay. Like you can still do it. It doesn't mean stop. It's not bad, but
Oh no,
um
100%.
yeah.
So it's very much like, we talk about what's necessary,
Hmm.
and when I come back to, are you going to do it? Do you hate it? And
Right.
so
Yeah,
if
exactly.
I never want to push things that, because I get that all the time. People are like, oh, do I have to do this? I really don't like it. It really bothers this and that, and
Hmm.
I'm like, then don't do it.
Right.
And that goes for everything. If you're somebody,
Yes.
if you hate a specific exercise, don't do
Don't
that.
do
There's
it.
always another
Yes.
exercise.
No, we run into that all the time. Is like, they're like, what should I be doing? I'm like, what do you want to do? And then I will adapt what you want to do to what I need to address whatever your issue is. But again, like that's, 100,000 foot view. And really where we should be thinking as far as exercise and movement for general public health is there has to be that enjoyment factor. You want to be doing it, you want to participate in it, you get something out of it, whether it's social or physical or whatever. But that's what's going to allow the consistency of what's going to keep us more active and healthier as we age. And that, again, it's not sexy. It's not sexy.
It's funny because a lot of these conversations we have about, is this better, or should you be doing this, or
Mhm.
should you avoid doing that? You would think that everyone was exercising, and we were just all kind of
Right.
doing it wrong. That's not the
No.
problem. People,
Mm-mm.
like, we just need more people to do
Right.
something, anything.
Right. No, and yeah, I think again, that's the hard part where, we see this micro where we're like, oh my gosh, everybody's telling everybody to do these tiny things. I'm like, we have much bigger problems here, people. Like, how do we tell our kids to get and stay active? How do we normalize talking about, our genitalia and not freak people out? How do we teach, normal eating habits and sleeping and kind of like just, can we just teach basic stuff? And no. No, we want the extra 1%, the 5%. Like we want to be told yes and no. Like
Yeah, or we want to follow these guidelines that are kind of assuming that exercise and diet is our entire life.
right.
Um,
Who's
and
got that time?
like, do we have multiple trainers, down the hall? Do we have a
Mm,
private chef making this, must have food that we need to be
I
eating?
want
And
that.
like, same. But it's like, that's why it also just starts to get completely unrealistic, because
Yeah.
you have a busy life, you have responsibilities, and so it's what you will do and can do
Yeah.
consistently, not this sort of pie in the sky thinking of, oh, everything can be optimal and I have all of this time and resources to accomplish that.
Yeah. No, that is not proven to be the case. In case anyone's curious about that, that is not proven to be the case. And I do not see a time coming in which I have all the time unless somebody wants to gift me the chef and the trainer and all that other stuff. So again, don't see that one coming. Any other ones that you can think of besides the weighted vest? Yeah, I've chatted about that one with people before too. Um,
The fact that you need to lift really, really heavy is another one that I
mm,
hear, and that you need to be doing, 5 rep max type sets with barbell exercises like squats and deadlifts.
mhm,
And although those are great exercises, and if you again enjoy training in those lower rep ranges, so really heavy weights, then that's great.
yeah.
But if you're somebody who's newer to lifting, that can sound really intimidating.
Mm-hmm.
And barbell exercises are technically challenging, meaning,
Mm-hmm.
just to master the movement pattern takes some time.
Yep.
So we should feel free to start with machines, start with dumbbells, start with bands, start with body weight, and then progress up from there. And there's nothing magic about doing these lower rep, super heavy sets. It just needs to be challenging. And so if I could do a set of 5 with 60 pounds, and that's really hard, but I could also do a set of 12 with 40 pounds, and that's really
Right.
hard. Or I could do a set of 20 with 25
Mm-hmm.
pounds, and that's really hard. All of those are viable options. And so
Yeah.
you can kind of choose based on preference.
Yeah. No, and again, individual. I had a mom I was working with yesterday, second kid, she's mostly a runner, and her just getting consistent with her weightlifting was huge. And but she was working to like it was a lightweight and then she would go up to like 30 reps. I'm like, why don't we shorten this up and see if you can lift heavier?
Yeah.
Not let's see if we can get you stronger. And she's like, yeah, I don't really feel much. I'm like, well, let's challenge you. But she's in a place where she's already established that habit and we can afford to do that. She's interested in it. It'll support her running. Great. But like I have other moms where like they've never picked up a weight in their entire life. And I'm like, hey, if 1 to 3 pounds or 5 pounds, whatever it is, I really don't care. If that's something that's exciting and new for you, let's see if we can try that, get it consistent, or like you said, go to the gym, try the machines. Like we got to stop putting barriers up for people because again, the bigger fish to fry is we need to get people more active. We need to get women more active. However we do that, then you can get the weeds on it. But yeah,
No, I
yeah,
think that's exactly as you said. We're just creating all of these barriers with this. You
yeah,
must eat in the morning, and you must have, 500 grams of protein, and you must exercise this way and not that way. It's all just
yeah.
making it so that people won't engage in fitness at all because
Mm-hmm.
it sounds like so much work,
It
um,
is.
and it sounds impossible.
Mm-hmm.
Where do you even start? How do you do that consistently? And so that is my concern around all of this messaging, is that
Mm-hmm.
people are just going to throw their hands up and say, I can't, I can't do this.
No, and I've done that. And I've totally done that. And that's why it was so refreshing to kind of learn more about you and kind of see some of this stuff. Because again, like if I, as a medical professional, as somebody in this space, I'm just like, I am confused. This is crazy. I don't have time for this shit. Like if I'm feeling like this, I can only imagine other people are feeling the same way. And so if there's anything that I've learned kind of navigating pregnancy postpartum is like we need to keep this as simple as possible and help people feel like it's not one more thing we need to guilt ourselves about because I'm kind of over that. So that's the beauty of perimenopause is we have less F's to give. So so thank you for that. If you guys want to learn more about Dr. Lauren and her myth-busting social media series and all the podcasts that she's been going on, you can check her out over on Instagram, Dr. Lauren CS1. Thank you, one, for taking on all of these myths because I know it's no small task, and two, for taking on the challenge of helping communicate better information because we need it more than ever right now. So thank you for doing that.
Thank you so much for having me.
If you're navigating pregnancy, postpartum, or perimenopause, whether personally or professionally, check out all our free resources and upcoming courses at carriepagliano.com. This podcast reflects the opinions of Dr. Carrie Pagliano and her guests, and it is for entertainment purposes only and should not be considered medical advice. Always consult your healthcare provider with any medical questions. If you enjoyed the episode, please take a moment to leave us a 5-star review on your favorite podcast platform. And thanks for listening.